Hello, and welcome to our daily COVID-19 update for the town of Plymouth. This is update number 24, coming to you live from PAC TV studios at noon on April 14th, 2020. I'm Steve Triffletti, your Plymouth Town Moderator, and we're here each day, Monday through Friday at noon for this update. This forum is being brought to you live by PAC TV on Comcast channels 13 and 15 and Verizon channels 43 and 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For your questions today, please email us at plymouthinfo@pactv.org. These forums can also be replayed at pactv.org/Plymouth. Today we have participants that will be joining Ken Tavares, Matt Muratore, and I, and they include Dr. Phillip Triffletti. He is a attending physician at Beth Israel Deaconess. Also, Dennis Wood. He is the Assistant Director for the Department of Public Works in the town of Plymouth. Joseph Young, and he is the Information Technology Director. Michelle Bratti, she is the Director of Elder Services. Stephen Cole, he is the Executive Director for the Plymouth Regional Economic Development Foundation. And as we do each day, we're going to begin with the Chair of the Plymouth Board of Selectmen, Kenneth Tavares. Ken, welcome.
Good afternoon to everyone. I want to start out today with an enormous thank you to the crews that performed some extraordinary work yesterday during the storm. Our DPW department was out removing trees from the roads and sidewalk areas, and Eversource had multiple outages. They were early this morning. Thank you. I think all of us, when we knew the storm was coming in, said, what next? But we were able to get through it because of the work done by the Eversource crews and the town departments, including police and fire. Thank you, thank you. Also, I'd like to announce that the Board of Directors for Plymouth 400 met late yesterday afternoon and agreed that the Maritime Festival that was scheduled for June of this year will be postponed to June of 2021. At that time, we hope that things will be much calmer and we'll be able to have a very successful event. Other events that were planned for this year are being considered on a one-on-one basis, and we'll have more information to forward to you, hopefully in the next few weeks. Thank you.
Thank you. And that's Kenneth Tavares. He's the chair of the Plymouth Board of Selectmen. You can send questions to him and our other participants by emailing plymouthinfo@pactv.org. And next, I'm delighted once again to welcome back Dr. Phillip Triffletti. He is a primary care attending physician at Beth Israel Deaconess. Welcome, Phil.
Thanks, Steve. It was a great opportunity to get dressed for a change, put on a tie and a jacket. First time in a few weeks.
So what's changed since the last time you were with us several weeks ago?
Yes. Well, I just wanted to give you a few updates on what's going on from the medical perspective. I know one of the questions you had recently come into you had to do with techniques about wearing masks. So I thought a little bit of discussion around masks would be helpful. There's basically two kinds of masks that we use medically. There's the surgical mask, and then there's the higher filter, what we call an N95 mask. And if you were a healthcare worker, they would be using surgical masks predominantly around patients who are COVID-19 suspects or patients, unless they were doing a high-risk procedure where the droplets might end up as an aerosol and flow through the air, as happens when they put a tube down the throat, what we call intubation, getting somebody ready for a ventilator. So we have different kinds of masks that we use for different reasons. And I've actually tried to do a lot of research on this to find how effective are masks and other personal protective equipment, PPE, in preventing infection. And the data is very difficult to come by, but interestingly enough, what I do find is that when it comes to masks, the most effective way to prevent yourself from getting COVID-19 is really the isolation techniques that we talk about in people self-isolating at home, staying at home. Not coming into contact with virus is really the number one way to prevent getting the virus. But the masks, I'm sure, do help somewhat. Again, data on scarves, which is now recommended in the state of Massachusetts to wear when you go outdoors. It's hard to find any data on how much it reduces droplet spread, but it probably does, work as a filter. Maybe half as effective as a mask, something along those lines. In regards to testing, unfortunately, we still have a scarcity of test kits. There are several institutions like my own, Beth Israel Deaconess, that's developing a drive-by testing method, and you would require a doctor's order, essentially, and clearance to go in for the test. The patients would have to have symptoms of being sick, which would either be a fever or feeling feverish or some other symptoms like cough, shortness of breath, or a sore throat to qualify. They have a priority way of determining, who are the highest risk people that need to be tested. But we're getting closer and closer, I think, now where we can test the general public. So I think week by week, you're going to see more availability of testing in your community and ability to get tested. Definitely making progress. In regards to treatments, I attended a great lecture with medical scientists from the Harvard Medical School facilities here in Boston, and it was very interesting to hear some of the things that they're working on. Unfortunately, we don't really have any one drug that's effective yet, that's ready, that we can say for sure, will help treat patients when they come in for COVID-19. They're putting a lot of patients into different study trials. Some of them are antiviral drugs. Remdesivir is one of the more common ones that they're looking at. They're looking at some anti-inflammatory drugs. Down in Johns Hopkins in Baltimore is one of the sites that's looking at the convalescent plasma, where you would give antibodies from somebody who's recovered from infection. But a lot of these things are not really ready to go yet, and they're still really under investigation. So again, I think if you were sick enough to be hospitalized, your main treatments, you would get some of these types of medications, hopefully in a study trial, but you would also be getting oxygen if you had low oxygen, and you'd get a ventilator, of course, in ICU if you were very sick. And then in regards to how long is this epidemic going to last? Of course, if you look at the data around the world and around the country, state by state, I can recommend, if you're interested in things like this, there's a website called trackthecurve.com, and you can access that through the internet easily at home, and you can get a chance to look at, what I prefer to look at is what's called daily new cases. And when you look at countries like Italy, Spain, they've seen a downturn in their daily new cases. The state of New York in the last week has started to see a downturn in their daily new cases. Massachusetts, not quite yet. We're still, trying to find evidence that we've reached the peak, what they call the apex, and that we're coming down the backside. But we're still at the more highest levels right now in terms of daily new cases. But we do believe that within the next week or so here in Massachusetts, we'll start to see a downturn. So that's encouraging. You've probably heard, if you're following the media and particularly listening to Dr. Fauci, and of course, many in government, we're a little challenged to know, when's going to be the safest time to reopen society. I think what we're hearing is, of course, it'll probably be a phased reopening of society, that it'll be gradual, before we start to have large gatherings again. That could be somewhere down the road. Some of the problem for reopening society, of course, is that, the experts talk about getting to a place we call herd immunity. That means that when at least half or so of the population has gotten infected with something like this coronavirus, that's when it's hard for the virus to be passed anymore from person to person. Instead of there being maybe 2 people available or 3 people available that you could spread it to, there might only be maybe 1 person, and that slows down the transmission of the virus in the public. Well, herd immunity, could take a couple of years to occur globally, but of course we're hoping still for vaccine before that time. And there's a lot of work being done on vaccines, but I can tell you that, the experts say it'll still be a year or so, maybe 18 months before we'll have a vaccine. There are a lot of issues in developing the vaccine. We have to make sure they're safe. In some cases, vaccines, we have to have companies be able to produce them. It may take a while to just, come up with a recipe and ripen it, so to speak. We have Dr. Baruch at Beth Israel Deaconess who's working on one of these vaccines with Johnson & Johnson, and the vaccine actually won't be ready to even be tested until September. So these are some of the challenges that we're having with developing the vaccine. It's going to take some time. And then lastly, I just want to give my last plug for, continuing our social distancing, physical distancing that we've been doing. This is our number one strategy right now, what we call mitigation to prevent the spread. Eventually, when we have small numbers of people getting infected, if that's in a month or two, hopefully, then we can go back to what's called contact tracing and containment. And that's what we have done in the past with things like measles. And that's what we can do once we have smaller numbers of cases to follow and start to reopen society. So I'll be ready for questions later. And thanks again, Steve, for having me on your program.
Dr. Phillip Triffletti, he is a primary care attending physician at Beth Israel Deaconess. We're happy to have him back again. And in the interest of full disclosure, yes, he is my brother. Each day we try to bring you officials as well as experts in fields responding to the COVID-19 virus. And the people on our panel today will be available to answer questions. Email us at plymouth.info@pactv.org. And speaking about those officials, we heard at the outset Selectman Chair Ken Tavares talking about our busy DPW, and coincidentally, we have the Assistant Director for the Plymouth Department of Public Works, Dennis Wood. Welcome, Dennis.
Thanks, Steve. Good morning. Glad to be here. Yeah, we have been very busy. The guys had a lot. We've been working on a skeleton crew mainly. We've had guys running the solid transfer stations and picking up the trash around the local buildings, the fire stations, the police station. And the mechanics have been in frequently to maintain the police cars on an every other day basis on that. But last night was a little extraordinary. We had the storm, so we had to have a lot of the tree and park guys and highway guys in to clear the roadways. And there's actually several crews in today working on clearing those roads. We have the street sweepers out because a lot of debris. So this is probably the last 24 hours is the most we've had in for staff right now. But they're doing a great job. They're keeping up. We've got a lot of calls. Other than that, it's just like I said, we've just been maintaining everything with the other departments.
Thank you. And that's Dennis Wood. He's the Assistant Director for the Department of Public Works for the town of Plymouth. You can email him your questions today. This is coming to you live on April 14th. We date stamp each day's presentation. You can send your questions to plymouth.info@pactv.org. And next, today we're also joined by Joseph Young, and he is the Information Technology Director. Welcome, Joe.
Good afternoon, and thank you for having me on today, Steve. I'd like to take this opportunity to talk about some of the technology being used behind the scenes to keep the town running. The town uses Office 365 as its email, meaning the employees can access their email onto your questions from anywhere they can get it. We built the new town hall in addition to a unified communications voice over IP system. This system allows us to take the office phones and forward them to cell phones. We can forward voice messages back to email, and we're using the built-in conference bridge for conference meetings remotely. Recently, we implemented Zoom as a boards and committees to meet and actually see and hear data, which is a big step up from just teleconferencing phone calls. On the employees' end, we utilize VPN technology to connect to all of the resources stored at 26 4th Street in our data center. Some of the departments using technology are finance, human resources, assessors, town management, town clerk, and the health department. Our financial management is also cloud-based. This allows finance, payroll, payables, collectors, procurement, inspectional services, and health to be able to continue operating remotely to provide services to the citizens. Now, the public-facing technology I'd like to talk about is our website. And I'm going to start a to help walk through what we're talking about. The town's website, plymouth-ma.gov, has a Citizens Action Center on the home. We use Google Analytics to determine where people are going to on our website, and we put the most frequently visited pages in this area. You find beach information, employment opportunities, contact us, subscribe, many different items. You come to the town's website and look for that. This is makes it much more convenient for them to find what information they're looking for. So we go into online payment. It's more than just online payment. You have your real estate, your excise, water and sewer, but you can also fill out forms from the town clerk's office. Death certificate, birth certificate, business certificate, all down the list. You see there's about a dozen items. Fill out or get sent to your home. This is the area we're working on to improve on for inspectional services in the health department. That should be coming. Another area to keep the public informed, contact us and put us as we wait for it to load. If you have an issue or you want to contact us, let us know about something you see going on around town. There's 8 or 10 options you can select on, type the comments, upload a photo if it's required, fill in a couple of fields, tell us you're not a robot, submit it, get emailed directly to the person responsible for it. If you're not sure who to respond to your problem or issue, general comments, go to the town manager's office, and they direct it to the person. The other area is subscribe. There are a number of pages on the website that you can subscribe to get emails, updates when they're updated. Put your email address in, confirm it. Town alerts is that red banner showing the COVID-19 information. Again, you're not a robot, subscribe. And every time one of these areas gets updated, you'll receive an email notification to go take a look and see what the update is. And with that, I'd like to thank you.
Thank you. And that is Joseph Young. He is the Information Technology Director for the town of Plymouth. Each week, we've been fortunate to have Michelle Bratti. She is the Director of Elder Services. She'll be with us each and every Tuesday. Welcome, Michelle.
Hi, Steve. Thanks for having me back. Hi. So just wanted to focus a little bit on, trying to update you on what we're doing at the Center for Active Living. Our staff remain very involved in making sure that senior needs are met in the town. We're answering calls, answering, emails, anything we can do to help. And we have a number of organizations that we're working with, primarily around food, our Meals on Wheels, running well days a week, distributing meals for the whole week to the citizens of Plymouth. And we are also working with the Nathan Hale Foundation. It's phenomenal in terms of supplying perishable and non-perishable foods for our seniors. We have a group of volunteers that goes and will pick up food and deliver it to seniors. Same with some pet supplies and some non-perishable food boxes being distributed through the same people that deal with the school lunches. So phenomenal community effort. Did today want to just touch briefly on something that I think needs to be addressed, and I want to make sure people out there have proper information. COVID-19 is, as we know, a health crisis for all of us. And on our best day, sometimes it's difficult to navigate information and process information and understand what we're dealing with and what our future holds. Imagine what it must feel like to those with dementia or Alzheimer's, and to the caregivers in our town that are caring for either spouses or loved ones with dementia and Alzheimer's. It's not easy. It's research has shown that this particular time right now, it's extremely difficult because it's confusing and it creates a lot of uncertainty. And that can be very difficult both on someone with dementia and the caregiver. So just wanted to give a few resources for families out there in our area that need some extra support or really want to ask some very specific questions, whether it be about COVID and the impact on their loved one, or just a general question, how they may access services. We know there are barriers to services all over at this time. I have two really good resources, and if people have questions, a local agency is the Alzheimer Family Support Center of Cape Cod. The Center for Active Living has done a lot of work with them and partnered with them just in general business. And they are phenomenal with working with families with those affected by Alzheimer's. They're open 7 days a week. Their number is 508-896-5170. Also, the Alzheimer's Association is a very reputable, known association. They do a tremendous amount of research and a ton of work just offering support for families. They recognize that COVID-19 right now is just a different set of circumstances. And they have a free 24/7 hotline for caregivers, for resources, questions, general support. They are open, as I said, it's 24/7. If you're a caregiver and you're worried about a loved one or just have questions, or you yourself suffer from dementia and just want to know about your resources, their free 24/7 hotline is 1-800-272-3900. I encourage people to sign up for the Center for Active Living's Constant Contact, and that is our email resource. We send it several times a week. You would call Beth Hadfield at 508-830-4230. Just give us your email address and we will send you this, it's called Constant Contact. We will send you a link, and it's like a virtual newsletter. And in it, we will have all of this information that I'm talking about. It will have all the resources for food and food distributors that we're working with. It will have links to the town, to the CDC, to mass.gov, all the tools you need to be prepared and informed right at your fingertips. So it's free, and it's through the Center for Active Living. So I encourage anybody with an email to sign up for that because it really keeps you in the know. The other thing, Steve, that I just wanted to talk about really briefly, and we've talked about it before, but I want to keep reiterating that the scams are out there, and particularly the most vulnerable are our elder population. They seem to be targeted the most. Predominantly, there are two major scams that I'm hearing of that are going around. There are people that are calling and telling you that they will assist you in filing your taxes for you. Even though we have an extension, they'll tell you that there are certain things you need to do, or there are certain things that they can do for you so you don't have to stress about taxes. Please Do not give any personal information. Do not engage with those people. That is a scam. The second one, of course, there are stimulus checks being given by the government right now. People are calling saying, if you want your stimulus check, you must give me this information. They're saying that they'll help you get your stimulus check quicker. Please don't share any identifying information with people that are calling asking for that. More than likely, it's a scam. At the end of the day, if you have any question or a tiny bit of doubt or panic about someone who's calling asking for something, simply ask them for their phone number and let them know you'll get back to them. Call us at the Center for Active Living, call the Sheriff's Department, call the police station, anyone that you feel comfortable calling and asking to help identify whether this is legitimate information.
Thank you.
So, thank you.
Michelle Bratti, she is the Director of Elder Services, and she mentions the scams and the sheriff, and this Friday we'll be welcoming back Sheriff Joseph McDonald along with Plymouth County District Attorney Timothy Cruz to talk to us about scams. And at this time, we welcome once again on Tuesdays and Thursdays, Stephen Cole. He's the Executive Director for the Plymouth Regional Economic Development Foundation. Welcome, Steve.
Thank you, Steve. I didn't realize you knew I had a schedule. It was Tuesdays and Thursdays on my regular. Thank you for noticing. I am joining you again from my very own home, which is endearingly the Hermitage these days, as I'm sure many folks have become hermits also. I did want to update you on the gift card giveaway that the foundation was conducting. I will say that I think it was a fairly successful program in a short time and turnaround. In just 6 days, we had over 500 people enter. And yesterday, Ed and I finished rounding up the selection. So we're in the midst right now of purchasing those gift cards and getting them into the hands of the winners. If anybody at home submitted a name or an entry and would like to know whether you won ahead of the announcement, I'd be very glad to let you know if and what you did win. Steve, last time I appeared, though, I did receive a question. And although it's been fun doing the giveaway, there are some very real situations out there that a lot of folks are reconciling with. The question that came to me was, what good things can possibly come from this? Let us not forget, it's more than just a virus. This is a complete global disruption. Supply chains are obviously disrupted. I think many folks are learning that there's a very different supply chain for commercial toilet paper than there is for residential toilet paper, as one example. The same is true for food chains, food supply chains and restaurants and grocery stores. Focusing though specifically on our area, housing, traffic and transportation, and workforce development are oftentimes the things that rise to the top that folks are most concerned about. Housing is obvious because with 2% vacancy in our area, young people have a harder time finding places to stay, especially if they're from here. That's a problem for a lot of reasons. And in our area, we have a lot of second homes. What we can reasonably expect as a result of this is that the housing market in our area will likely free up. People who own second homes will either convert from weekly rentals in the summer to year-round rentals because the uncertainty will certainly be there with tourism and travel. So we have to expect that the housing market will take some kind of a redirection, but I don't see prices plummeting or decreasing. The governor obviously was talking about housing as an issue in our area prior to all of this. In fact, some of us might remember that GE had to give back $89 million from the incentive package because they didn't fully achieve all of the things that they said they were going to do at the seaport. And the governor unilaterally was constitutionally authorized to redirect those funds to support some of this housing initiative. So my sense is that as folks who are from New York or Connecticut are unable to afford their second homes, you might see some more homes come on the market, and you might see some of those weekly rentals convert to year-rounds. Something that came out of the state ahead of all of the coronavirus conversation, too, was a conversation about travel and transportation. We have about 5.5 million of us that live within the 128 Beltway, out of a state of maybe 6.5 million. All of us were working. 2.5% unemployment was pretty much the metric that I had seen consistently in Massachusetts for almost a decade. I mean, the 2.8 to 3.4% unemployment rate, that started under Governor Duvall's administration. That carried through the first administration, too, of Baker. And here we are now with 10% of the labor force in the United States now impacted with unemployment. I'll focus on unemployment in a moment and how we rebound from that, but I do want to focus on transportation and traffic. With fewer people on the road, there will be relief in the congestions that we've seen. Similarly, when we don't have that many people working or on the road at the same time, it doesn't put as much demand on the infrastructure. Some of the projects that we were seeing come out of the T or even MassDOT, $90 million price tag, capital improvement price tags, just to keep up with demand as it was then and to accommodate demand as it was projected to grow. This is a bit of a reset. I'm not saying all of our capital projects will have to go away. Some of them we have to obviously plan for. But the fact of the matter is, we're not going to be using the infrastructure or the public transportation the way we were before all of this. That's another little bit of a reset, and there is a silver lining there. I want to talk about the unemployment and the third matter, which is workforce development and entrepreneurship. Mass has not seen a lot of corporate growth in the last, say, 10 years. And that's partly because at 2.8% unemployment, you may not have been happy with your job or your second or your third job, but the fact of the matter is it wasn't enough to upset you so that you did something differently. Well, there's about 250,000 people who leave Plymouth County to go to work every day. And about 150,000 people drive into Plymouth County. Plymouth, the town of, our share is actually fairly nominal. About 22,000 people drive out of town to go to work, and about 15,000 people drive in town to come to work. 7,000 people drive from one end of town to the other. What I expect to see for our region, and I just want to say too, I mean, obviously we're not creating a lot of the traffic problems that we've seen both seasonally and fairly cyclically. But we're impacted by it because we're right on Route 3 and we're sandwiched lovely at a beautiful piece of real estate between Boston and Cape Cod. We're going to see a little bit of relief, I think, in the traffic and transportation. People won't be working, it's true. But when people start working again, they won't be making those same commutes. At least that's what economic development is certainly going to strive to achieve, is that as a quality of life measure, it's not a good quality of life to have to drive 3 to 4 hours every day. And I did that myself. So I certainly know the impacts that it can have on people. And there was a reason why for a while we were seeing fistfights on our highways. As people start to re-enter the workforce, they're going to want to work closer to home. And so I think that the long-term consequences of travel and transportation in the Commonwealth with this little bit of a reset will give us a little bit of maybe 5 or 10 year reprieve. Entrepreneurship is something that hasn't really seen or been talked an awful lot about in our area. And that's, again, partly because people were happy doing what they were doing. I want to challenge folks. I want people to think while you're at home, what type of a business would you want to run if you had the opportunity? Because the fact of the matter is we're not fully aware of what the economic consequences this will have on us. But it will be 12 months to 18 months before we start to see any real activity in the marketplace again, at least in some of these marketplaces. So those are the 3 areas I want to give you a little bit of a silver lining. I think we will see an increase in entrepreneurship. People who are now aware of problems in the supply chains and access to the resources, I think we'll strive to solve for those, and we'll see new types of businesses pop up as a result. Biomedical has always been something that Massachusetts has been known for, but not necessarily in our area. And in deference to our state friends and partners, they sometimes think of us as mostly an area of the world where cranberries come from. We are very well positioned to be able to attract new types of industries. We have clean lands, we have predictable processes, including the policies and the zoning that's in place. And we have great federal funding partners who are going to assist us, like the EDA, like the SBA, helping businesses grow during this time and to attract new types of businesses. Traffic, as I said, will certainly be mitigated for a while, and I think we'll still see some relief in the housing market. So thank you, Steve. I just wanted to share those thoughts with the audience, and if anybody has any questions, I'll always be glad to answer them.
That is Stephen Cole. He is the Executive Director for the Plymouth Regional Economic Development Foundation. You can send us your questions to plymouthinfo@pactv.org. We have received several, but now we're going to go to Plymouth State Representative Matthew Muratore. Matt, welcome.
Hey, good afternoon, Steve. Thank you to our guests. And, sitting here thinking and listening to all our guests and, Michelle and Joe and Denny, we got some incredible town employees, some really dedicated town employees who've been around a long time and really understand the workings of town government and the people of the town of Plymouth too. So hats go off to all of them for what they've been doing and what they continue to do, to all our town employees. Just doing a lot of things behind the scenes to keep us safe and keep us going. We really appreciate it. To start today's update, first of all, the governor will be on at 4 o'clock today. He's actually going to be at Joint Base Cape Cod in Bourne, so his conference will be from down there. They're actually going to be opening up another healthcare facility down on the base. So before I give the numbers, just a reminder, as Dr. Triffletti was talking about, here in Massachusetts, we are still seeing the surge increase. The numbers have not started flattening out yet, but we are in that window that we've been talking about. All along, we said between April 10th and April 20th, we will see the surge, and we are in that as we speak. We also talked several weeks ago, and we started this, about the models that were out there. And the prediction in Massachusetts were that between 47,000 and 200,005 people will actually be confirmed with the coronavirus. And the deaths were predicted somewhere between 705 and 2,500. So we seem to be tracking on that. So this is the next week or so are going to be the worst days coming up, but we should see light at the end of the tunnel after that. Everything is working that we're doing by staying at home. So the more we can do that, the better we will get, the quicker we'll get past this. So let's talk about some numbers real quick. These are as of 10 a.m. Yesterday morning, which was April 13th. Out of almost 6 million people in the Commonwealth, 1.7% have been tested, which is 122,049 people. Of those tested, 22% have been confirmed with the coronavirus. That's up from 1,392 from yesterday to a total of 26,867. And out of those, the number of folks who have unfortunately passed away is 3.1%, or 844 deaths, and that was 88 more from yesterday. In Plymouth County, we have 512,000 people in Plymouth County. 2,141 have been confirmed with the coronavirus, which is less than 0.5%. And in Plymouth, we have 99 people that have been confirmed with 1 death. And that is, again, less than 1% of our population in the town of Plymouth. In long-term care facilities, there's been over 3,800 tests in 227 facilities. And there's almost 1,000 facilities in the Commonwealth that include senior nursing facilities, assisted livings, rest homes, senior living communities. And in those, there have been 3,446 confirmed cases that include residents as well as staff in 201 of those facilities, at least having 1 confirmed, with 378 deaths. So almost 45% of the deaths we're seeing in the Commonwealth are coming from these senior living facilities. There are 44 facilities that have now doing their own tests. So as of yesterday, I think we talked about this, a assisted living, nursing homes, senior housing project, you can actually request tests from the command center and do testing on site now, as long as staff are properly trained to do that. So 44 facilities as of yesterday have now requested those tests and will be testing. And as Dr. Triffletti said, the more we test, the more we can do the tracing, the quicker we can get back to life as we know it, which will still take several weeks, if not months. But the more we can trace and test, the better off we're going to be. Yesterday, the governor announced that there's grant money for manufacturers to produce PPE, the personal protective equipment. And that is important because it's not just for now with the surge going on, but it's also for beyond that. Because when things do get back to normal, we're still going to need equipment. We're still going to need all this, the face masks and the gowns and the gloves in these facilities. So we need to not only catch up, but also start producing so we're ahead of the curve as well. So we thank all these manufacturers who have never done these type of pieces of equipment before, but they are stepping up now to do that. There is, the Commonwealth has now set up a PPE equipment chart. So if you want to go on mass.gov COVID-19, you can see what parts of the state that the N95 mask that Dr. Triffletti was talking about, regular masks, gowns, gloves, how many pieces have been going to certain parts of the healthcare providers in the Commonwealth. And in addition, there's a bed capacity chart to show us where the beds are in hospitals throughout the Commonwealth. In our region, in the Southeast, as of yesterday, there are 13% available ICU beds that include for the surge, and there are 39,000 non-ICU beds open, including for the surge. So we still have some capacity still open, although the numbers are a little thin, but we still have capacity there. Today at the State House, there are economic experts sitting around talking about what it's going to look like after we go through this and the economy opens back up. Both chairs of the Senate House Ways and Senate Ways and Means and the House Ways and Means, along with the financial people from the governor's office, are at this meeting as we speak. The expected, the preliminary numbers that are coming out is the expected drop in revenue from the Commonwealth this year in 2020 will be about 20%. So we have a $43 billion budget. So you can do the math of how much we'll be looking less in income in 2020. And the unemployment rate will probably reach up to about 15 to 20% here in the Commonwealth here in 2020. A couple of reminders. One more thing too. The governor actually is joining, I think, 5 or 6 other governors here in the Northeast, from Delaware, New York, and some other states, to start talking about how do you actually open up the economy? When does that happen? And more importantly, how does that happen? I don't think any of us should think that on May 5th that the economy is just going to turn the switch is going to turn back on and we're all going to go back to life as usual. That's not going to happen. As Dr. Triffletti said, we need to get a handle of where this virus is. It's still out there, but tracing the virus is what's going to be important, and getting tests to people is what's going to be important. So those discussions are starting to be had, which is a good sign that we will get to back at some point. But the discussions of how we get back and how quickly we get back will be forthcoming over the next several weeks. Finally, on the federal side, just as a reminder that the census was due April 1st, but it's obviously not too late to do that. There's 48% of the Commonwealth, folks in the Commonwealth have done the census, the US Census. More needs to be done, so there's been an extension on that. The collections will be through October 31st of this year. And the field office, usually there's people that go around to your house, and that was going to be scheduled April 1st, and it was moved to April 15th. Now that's going to be June 1st. But the more you can actually fill out your census and get the census in automatically through the website, the less amount of people that'll have to go around to collect the census from your house this year. So, and I want to just say one thing too. If there's any silver lining in all this, and I keep hearing this from a lot of people, and it's the whole thing about doing what we're doing, but more so with healthcare. As a healthcare provider, it's something that I've been advocating for a dozen years or now, which is telehealth, and trying to get in front of a physician with a patient doing exactly what we're doing now. And that is really making a huge difference in not just healthcare, behavioral health, but in so many other ways as well. So I think a silver lining that's going to come out of all this is that we'll be able to communicate with our healthcare providers, whether it's social or behavioral or physical, in a whole different way now. And I think that'll be a good thing for the whole healthcare system. So that's just my healthcare editorial note for today. Thank you, Steve.
Matthew Muratore, Plymouth State Representative. We're going to be going to our questions. You've been emailing us at plymouthinfo@pactv.org. And just a reminder, we'll be back here tomorrow at noon. We'll be joined by Patricia Fry. She's the Assistant Superintendent for Human Resources. And each Wednesday, we're also joined by Heather Cosby. She is a local CPA. Michael Jackman from staff at Congressman Keating's office, and Amy Naples, Plymouth Area Chamber of Commerce. And they'll be joining Matt, Ken, and I. And at this time, our first question goes back to Dr. Phil, and the viewer asks, you talked a little bit about the masks. what is your opinion on gloves? If they're not used properly, are we better washing our hands with soap and water?
That's a very good question. I think a lot of it has to do with what your level of exposure is. So obviously for healthcare workers, and they using protective equipment around patients who are either suspect COVID-19 or have COVID-19, they're going to wear an ensemble of a mask, gloves, and a gown. And they'll also carefully wash after their work shifts when they go home. And they have protocols for how to don the equipment and how to, doff the equipment, take it off. But I think in the general public, gloves are probably not so necessary. I do think that, hand washing is really still probably the most important thing that we do. What I do when I go out is I bring hand sanitizer with me. If there's a hand sanitizer, if I go to the grocery store or the pharmacy, or, I will use their products if I'm picking up food from a restaurant, and I'll make sure that I hand sanitize before I get back in my car, and try to keep the car clean and other contents clean. So I would say in general, unless you're working around somebody who's got COVID-19, I don't think, gloves would be necessary.
Thank you, Dr. Phillip Triffletti, primary care physician, Beth Israel Deaconess. The next question, I'm not sure whether or not you can answer it, Dennis, or whether we go to Ken. We know that the requirement of smoke detector inspections has been extended, but is the town of Plymouth still conducting smoke detector and carbon monoxide detector inspections? Dennis, are you familiar with that?
Oh, I don't have the answer for that one.
How about Ken? Do you know whether we're still doing inspections?
I will have to check with Chief Bradley.
Thank you. We'll get back to the viewer on that. We're now going to go to Joseph Young, and the question is, should folks be more worried about malware and other threats now, especially with so many people working and communicating online? Joe?
Yes,
Malware.
definitely, Steve.
Malware.
Yes, as Michelle brought up, there's scammers trying to exploit this COVID-19 pandemic, and they're going to use any means possible to get your personal information. So my recommendation is always on the side of
people want to just visit it.
check your email, verify links in emails, check for misspellings. These cyber bad actors are out there, and they're gonna use any means they can to get your information and take your money.
Thank you. And that's Joseph Young. He is the next, we're going to go to Stephen Cole. Steve, one of our viewers writes that the viewer wishes to patronize a local restaurant in order to order takeout, but that restaurant is offering curbside pickup. Is the curbside pickup safe?
Oh, I'll have to defer to the medical experts for that. Frankly, I'm disseminating information as it's being received by me, by those experts. So if they say it's safe, then I frankly have to defer to them. I've been performing curbside pickups myself when I go out and I order. It's limited. I try to cook in as much as possible. But as for now, it is something that I understand has been deemed okay as long as we take the right precautions.
Thank you. That's Stephen Cole. He's the Executive Director, Plymouth Regional Economic Foundation. Dr. Triffletti, what is your opinion on a slow opening of different parts of the Commonwealth of Massachusetts, and what would be the criteria for a slow opening?
Probably two main points I'd make about a slow opening. I think, first of all, when they talk about this curve and the apex, you really want to probably be, well down on the backside of the curve. And so instead of having, several hundred new cases a day, you'd probably like to see it, considerably less than that. You'd like to have the capacity to do this, what I call contact tracing or containment, when you are opening up society again. So right now we have so many cases occurring every day, we really can't track all those cases in that manner, but you really like to have smaller numbers of cases before you're opening up society. The second point I want to make really has to do about the healthcare system capacity. And so when everyone was talking about flattening the curve, the purpose there was not to experience really what probably happened in Italy, which is, they had too many cases too fast, and then they eclipsed the capacity to care for the very sick patients. So they ran out of hospital beds, they ran out of ICU beds, they ran out of ventilators, which is, one of the most most critical, important pieces of equipment and treatment that we have for patients that get the most sick with pneumonia from the COVID-19. So the theory is that when you're starting to reopen society, if your cases per day is low, you're not going to you'll have capacity in your hospitals, you'll have capacity in your ICUs, you'll have capacity with your ventilators for the most sick patients, and you won't run into a shortage, as was feared in New York State, for instance. So that's what we're looking for before we reopen society. We want the new cases per day to be considerably lower, probably, maybe 10% or less of what we're currently seeing.
Thank you, Dr. Phillip Triffletti, primary care attending physician, Beth Israel Deaconess. A viewer asked about the status of testing in Plymouth, and yesterday we announced that the hospital campus in Plymouth announced that there is still very limited drive-up testing at the hospital for hospital employees and first responders only, and by appointment. The drive-up testing is not open to the general public at this time, and if and when it'll be appointment, it'll be through one's primary care physician, and this is a partnership with the town of Plymouth. At this time, we're going to go through all of our participants and ask for a final closing statement, and we're going to begin with Dennis Wood. Dennis, what would be a takeaway that you'd want people to remember today?
Biggest thing is people should be staying home if they can, and not going out unless it's an absolute necessity. Let everybody do their jobs and safely do their jobs. I know a lot of people want to go for walks and stuff like that. That's what we've been a lot of buildup is the trash downtown and stuff like that. And we really limit uses as much as they can, but also in the same time to get out. Also, Steve, due to the storm, we had a lot of debris down. We had the crews in working. We're also going to do a collection of debris, storm debris, on the 25th and 26th this month. It'll be limited. People stay in their vehicles. We can do that and keep everybody apart, but also give the assistance to the town to get rid of that debris they need to get rid of.
Thank you. That's Dennis Wood. He's the Assistant Director for the Department of Public Works for the town of Plymouth. Joseph Young, you are the Information Technology Director. What would be your final message to
can
the
you hear me?
people who are
I'm
watching?
getting some reports that
Joe.
was very unclear during my talk.
Joe, can you unplug that? And what are your final thoughts?
Yes. No.
Okay. Can you hear us? Joe, do you have anything else you'd like to add today? We'll come back to Joe if we can hear him. We're going to go to Michelle Bratti. She is the Director of Elder Services. Michelle, what would be a takeaway you'd like to give to our viewers?
Well, Steve, probably the same takeaway that I always do. Obviously, the Center for Active Living, formerly Council on Aging, deals primarily with the senior population in Plymouth, and we feel very protective of that population. Our duty is to serve and protect them on a good day. With COVID-19, we're asking the Plymouth community to take up the same mission. That is our at-risk group. Those are the people in our community. Those are our elders. Those are your parents, grandparents, uncles, aunts. We want to ensure that we take care of our seniors. And we can all do our part by recognizing what the medical field and health experts have said and what the town management has said in terms of this. We can help protect that group and flatten that curve by understanding that whether we ever show symptoms or not, we can be a carrier. We need to stay home, follow the proper procedures, and really that is potentially saving a life of someone in this town, an elder in this town. Just look out for each other. I wanted to add one more thing, and I kept forgetting to say it, and I wanted to ensure that I did a correction. We received a donation, a wonderful donation, and it was from the Plymouth Retired Employees Association. And I did say their name wrong. So in fairness, I want to make sure they donated on gift cards to the Center for Active Living. And we purchased some household items. We do not have hand sanitizer. We do not have Lysol. I need to say that. But we do have some basic household needs. If you need anything, call the center. And we had a wonderful donation this morning from Mark Hansen, who's becoming the angel of the Center for Active Living. A very small supply, but seniors have been calling saying, listen, the directive is we should wear masks when we're in public. We don't get out much. We're not supposed to get out much. Where would we get a mask? We are putting on our constant contact coming up how to make your own masks. So if you sign up for that, you will see instruction. But we did get a small donation, small number of mask kits, cloth mask kits. And we have a wonderful staff member, Todd, thank you, who is going to be sewing those kits. And if seniors need a mask, let us know. Again, very small supply, but more than happy to distribute those as they were so kindly given to us. So thank you, Steve.
Thank you. That's Michelle Bratti. She's the Director of Elder Services. Stephen Cole, your final thoughts today.
And for the opportunity. Final thoughts largely are going to be the same as I always share. I mean, I think it's important for folks to be well informed and to participate in the economy as safely as they can. A safe and healthy population will be the best thing we need in order to recover from any kind of economic reset from this. So please stay healthy, please stay safe, and please do know that there is also no contact curbside pickup and delivery available for those folks who are particularly concerned about that.
Thank you. Stephen Cole is the Executive Director, Plymouth Regional Economic Development Foundation. Dr. Phillip Triffletti, anything you'd like to further add to today's presentation? Dr. Phil.
Sure. Thanks, Steve. So I would just advise people, as hard as it can be, to be patient, that this is really a temporary phase of time we're going through. Eventually, things will get back to a newer normal, and maybe somewhat different than, the normal that we had before the COVID-19 outbreak. I know some people are very afraid of infection. I've talked to colleagues who are healthcare workers are afraid of working around infected patients. I had a couple of colleagues get infected recently, but they're doing well. I think the thing that always remember, while it can be a tragic and deadly disease, most people who get the infection will have mild illness. Most will survive, even if you're over 80 years old. The vast majority of people would survive still if they get this infection. So, while it is, something to be avoided, most people will do very well, even if they're exposed. So I would say stay connected to your friends in a virtual way, and stay connected with your doctor and healthcare as best you can. Like Matt Muratore mentioned, the telehealth is a good resource you can use now that we're up and running with that.
Dr. Phillip Triffletti, he is an attending primary care physician, Beth Israel Deaconess. We're going to go back to Joseph Young and see if we can get Joe's final takeaway message. Joe.
Steve, hopefully you can hear me now.
Yes, we can. Go ahead.
Yeah, I'd just like to go back to be careful. Don't fall for any of these scammers sending you emails. Verify phone numbers. Double check emails that are embedded. And be safe, everybody.
Thank you. Joseph Young is the Information Technology Director, and we're going to close out with Matt Muratore's final statement. Matt?
Thank you, Steve, and thank you to all the guests today. As I close out every day, stay informed. Go to mass.gov/COVID-19. If you have questions, call 211 or reach out to my office, myself or Betty. Get alerts by text. That's the best way to find out, like when the governor's going to be speaking. Go to COVID-MA to 888-777. Or if you have health questions, go to bowie.com/mask. Stay calm and stay home. And remember, the more we come together by staying apart, the faster we'll get back to the people we love and the things we love to do. Thanks again, Steve. Thanks again to PAC TV and to everyone out there that's keeping the economy going and keeping us safe.
Plymouth State Representative Matthew Muratore. We began with the Chair of the Board of Selectmen. We will end with Kenneth Tavares. Ken, your closing statement.
Thank you, Steve. I did get a message back from Chief Bradley, and the answer to the question of testing is no at the time. Also, I want to remind those watching that the Board of Selectmen will conduct a meeting at 1:30 today, live on this station. Also, take a little bit from Dr. Triffletti. He mentioned one of the words that I've been using quite a bit in the last couple of weeks, and that's patience. None of us signed up for this. It certainly is difficult, but we need to have more patience with one another. I've been reviewing some emails that have been coming in the last 24 hours, and to use a simple term, we need to adjust the attitude a little bit. Together, working together through this, we've certainly done a good job working with our state partners, and this I know will continue. My advice is to follow the governor's lead, and that is to stay at home, wash your hands, and use those masks. Thank you.
Thank you. That's Kenneth Tavares, Chair of the Plymouth Board of Selectmen. And as you can see, we have our town officials and our experts answering questions as they come on live airing of this show. I want to thank Ken Tavares, Matt Muratore, and all of our participants, Dr. Phillip Triffletti, Dennis Wood, Joseph Young, Michelle Bratti, and Stephen Cole. My name is Steve Triffletti, Plymouth Town Moderator. Thank you for joining us. Good day.